Right. Good afternoon, everyone. It's a pleasure to welcome you all to this afternoon's event. We just decided to keep the doors open ever so slightly for the next 10 to 15 minutes for any people that might trickle in, but then we'll close it up for the screening of the event. It's a real pleasure to welcome you to this afternoon's event. My name is Nakiswa. I also go by Nikki, and I work as the Engagement and Communications Coordinator for Invisible Flock as part of the Body Ecologies research project. We have quite a full afternoon lined up for you. So there will be a film screening, as you know. For the film running time is about 1 hour and 20 minutes, and that will start in the next half an hour, followed by a short break, and then we will have a discussion, and we have some online panelists joining us from all over, which is quite exciting, and then we'll open the floor to you as well. Just a few housekeeping announcements before we get in. Should you require any comfort breaks during the afternoon's event, there are bathrooms that are found just out through the doors towards my left hand, so your right hand side. There's a little green button which says exit, and you can just press that and then walk out, and you'll see bathrooms on your left. In the case of an emergency, there are fire exits down this corridor as well. If you keep going straight past the bathrooms, turn right through the doors, then you will find some fire exits. There will be photos taken during today's event. If anyone feels uncomfortable with this, please find one of my team. So we are wearing the yellow lanyard, and then we'll give you a sticker just to mark that. We will also be tweeting, and we're on social media, so you can tag us during today's event. You can tag at Body Ecologies to give mental health, and later on this afternoon we will have all the speaker bios, and you can follow everyone joining. As I mentioned, the film is about 1 hour 20 minutes, so I would advise you to keep your phones on silent during the film and during the discussion, as it will disrupt the speakers, and also just to make the most of it. There is some sensitive content in the film, so feel free if you need to take a moment to step out and come back in as you feel comfortable. And yes, without further ado, it's my pleasure to read a bit of a description about our moderator today, Erminia Colucci. Thanks for bearing with my many pieces of paper. So, Erminia Colucci is Associate Professor in Visual and Cultural Psychology at the Department of Psychology at Middlesex University, London, and Visiting Professor at Gadjah Mada University, Indonesia. Erminia is passionate about using arts-based and visual methods in her research, teaching and advocacy activities in cultural and global mental health, with a focus on low to middle income countries and immigrant and refugee populations. Her research and visual project documentaries have won several prizes. It is a great pleasure to have you and to be working with you, Erminia, on this event, so I'll hand over to you. Thank you.
Thank you, Nikki. And thank you for those of you who came here today. Other people are not online, so people online. And thank you to LB for organizing this event. It's been some time, as most things lately, with the COVID and stuff, so it's nice to be able to be here in person and have a conversation. A very strong light. I don't have to find a position that doesn't make me blind. So I'm going to keep the introduction very, very small, because usually, as also I can testify in our last event last week at Big Cinema, usually people have a lot of questions and comments. So we want to make sure there is enough time for all of those, or as many as we can. Just to give a little bit of a background, and I thought I'd just say something methodologically and conceptually. Hello, good evening. In terms of where this project is coming about. So methodologically, the background of this project comes from another project in mental health and human rights, which is called the Breaking the Chains. I don't know if any of you has watched any of the Breaking the Chains film. But that project was based in Indonesia and was looking on the issues of human rights, a particular practice used in Indonesia. And for that, I spent time there, and it was a 3 outcomes, a photography collection, a ethnographic documentary, which is called The Breaking the Chains, and then a shorter film, which I made with Agus, who was there before on the screen, and will be joining from Indonesia for the discussion. Hi, Agus, my dear friend Agus. So we worked together for many years to make a film about him. So that film, then I presented the film in a conference in Manchester where I did my Vision Anthropology degree, where I met Ursula Read, who I had known by her fantastic writing, but we met in person. And we started sharing our own understanding, our own experiences, in my case, in Indonesia through this project and other projects, and with Ursula doing several years' work in Ghana. And we found some similarities in terms of our own questions, our own observations, in terms of the importance and the role that faith-based and traditional healers played in both these countries, and the issues around collaboration with mental health professionals. So that's how this project came about. So it's interesting actually to be here and welcome, I thought, to coming here, because Ursula and I then applied for fundings through a fellowship, and I was the person going for this fellowship. A welcome. So because we thought that this is such a welcome project. So we applied to the Wellcome Trust, and myself and the project were shortlisted. But sadly, in the final committee, there was nobody in mental health. So the project was actually assessed by people who had not much idea about mental health or Ghana or Indonesia. And I'm very glad to see the Wellcome. I kind of moved on since then, and my mental health is very much more part of what actually happens here. And today, our presence here is a testimony, and also, I guess, a diversity of discipline involved in doing this kind of project. So then we jumped when the Global Challenges Research Fund became available, and we made this project happen. So it's nice kind of to be here now and showing this film, which is a collaboration between different institutions in Ghana, Indonesia, and in the UK. Today, I'm going to be meeting me and Ursula, and we talk about our own experiences in these countries, but you will see Lily as well later on, who was a research fellow for Ghana, and Diana from Indonesia. So this project, so Nkabom, this film really comes from this research question. So it's a research film. It comes from our inquiry around the issue on collaboration between mental health professionals and traditional healers and faith-based healers. Is about looking for some kind of good practices about what makes collaborations, when they are possible, what makes it possible. And when there are barriers which are there, what actually are some of the facilitators in terms of overcoming these barriers. There is 2 main films from this project, Nkabom, which I'm going to be watching very shortly, and Harmony, Healing Together, which is an Indonesian film, which we also hope to screen when Diana, who just got a UK visa, finally, will be coming to this country. So if you are interested in this project, in this film, do follow the page, I think we're going to see later, Movement, where we post about our screenings. And I think this probably is, I want to leave you with this question we had, and what actually came out of this visual research project. So, well, enjoy the screening, and we'll be here later on to take question and observation and learn together. Thank you. Thank you for coming back. It's nice to see you back for the discussion, and looking forward for getting into that. But before we do so, I have the honor of being the moderator as well, and I will introduce the wonderful people in our panel. Getting the paper. There we go. So here we have, I think it's Ben Eaton. Hi Ben, can you hear us? Hi, I can look here, she's in front of me. Hi Ben, we cannot hear you.
Oh.
Yes, we can.
Hi, good evening.
So Ben is a digital artist and technical director of Invisible Flock, an artist studio that operates at the intersection of art and technology. A team member of Body Ecologies, who is hosting us today, as you know. And he's currently working with a focus on sound, non-conventional field recording, and new methods of sound design. You are connected from where right now? Which country?
I'm in Karachi in Pakistan. We're opening a new piece of work this week, so I'm over there installing that. So I'm sad to not be with you, but yes, I'm a long way away.
Oh, wow, wonderful. Okay, thank you for being with us from Pakistan. I do a lot of work over there as well. So Lily, our Lily, oh, we're supposed to be here right now in the middle, the queen position, but you are in Ghana, but we'll get you here. Don't you worry, sooner or later, and hopefully I was saying we have more screening when both Diana and Lily manage to get in this very migrant-friendly country. Then we can organize other events, so do follow us, because you have to meet Lily in person. But we are super pleased we were able to organize so she can be with us on the screen. Lily is many things, but I will have a little summary. Is a research fellow at the University of Ghana. She has a background in psychology and public mental health. Her research has looked at traditional and faith healing in Ghana, exploring ways to understand help-seeking pathways and to improve community mental health experiences. Thank you, Lily, for being with us.
Thank you.
So I'm following the order. Liliana, hi Liliana. So Lilian, so reputa Eda, Italian. Lilian,
Hi.
Lilian. Lilian Maina?
Yes.
Yes, is a team member also of Land Body Ecologies through OGEC People's Development Program in Kenya. And she an organization of which she is communications and media officer. Lilian has worked on the production of Land Body Ecologies podcast, leading on the recordings of interviews and sound in the landscape carried out in the Mau forest and among the OGEC community. And Lilian, you are connected from?
Narok County, Kenya.
From what? Kenya. Okay, wonderful.
Kenya.
Oh, fantastic. Wow, what a nice multi-international group here. Then Ursula, here on my left side, look at you. Ursula Read is a senior research fellow at the University of Warwick. She has conducted long-term ethnographic research in Ghana, focusing on the experiences of people living with serious mental illness and their families, community mental health care, and use of traditional and faith healing. And then my dear friend Agus. Hi Agus.
Hi everyone.
Agus Sugianto is a mental health advocate. Also him is many things, but here we go. He co-leads a South Asia Regional Global Mental Health Peer Network, a lived experience lecturer, and a specialist consultant and researcher on mental health promotion for Indonesian community care for schizophrenia. And as I mentioned at the beginning, for those of you who joined later, if you want to know more about who Agus is, you can watch a freely available movie called Breaking the Chains, Anto's story, where you will also see his wonderful artistic work. So, but thank you, Agus, for connecting with us from Jakarta. No, you're home, right?
Indonesia.
Yeah,
East
at home.
Java.
Wonderful. Thank you. So as a moderator, I have the benefit of asking the first questions while you are making your questions, the people in the audience and the people at home. Amy is collecting your questions. I have a phone here and I just bought a very nice new case. Very serious professional, cats and dogs, because I love animals and insects, as you can see. So I will be checking my phone, not because I'm getting bored, but because my mom is calling me, which can happen, apologies for that. So I can check the questions also asked from home. So comments or anything you want to share with us. So I'll be going to be going between different questions, but I get honored to choose where to start and what to ask. And I'm going to start with you, Agus, if it's okay? So my question to you is, as an artist and as someone with lived experience, what do you think is the potential of creative and visual methodologies in mental health research? What do these methods bring to mental health research and advocacy?
Okay, I would like to answer that with some clarification, because at first, when I joined our first collaboration, I wasn't really sure what to do, and I signed the consent, but I just had this intention of sharing. That's what I wanted to do at the first time. That's why I joined our collaboration movie. So through times, I learned that this creative visual method has some benefits for, especially in the mental health research and campaign. So actually, with this method, there is a big involvement and empowerment of people with lived experience to be empowered because they can choose what to tell, and there is a freedom of to deliver. And as our experience, you give me the chance to decide what to share, what not to share. Even it's developed into. I co-directed the movie with you, even doing the translation, doing the transcribing, and helping, in such so many ways. So it gives me a feeling of there is no power imbalance. So as me as a participant and you as a researcher, so this is a good thing that I was regarded as a fully human with a feeling and not just an object. So in terms of the advocacy, so it brings my advocacy into the next level, where in compared to this usual research when it only produces papers and journals where only people with academic background to read that. With this movie, I can do more, even to reach a larger audience, where as a result for this like this movie and our movie, now it's released international. So at first, like when we first month when it was launched, it's only 600 people, but now I checked, it's about 25k people watch our movie. So that's amazing. It also can be used as a source of learning and source for sharing, and has this potential influence because using my movie I could touch a lot of people. It's a touching visual, and it displays my art as an artist and as an art worker. I can touch a lot of policymakers and people who brought the policy, and students, academicians, and also everywhere in the world. So I think that's all I can say. So I'm glad to be part of it, and I have no regret of joining. But I would like to make we have to be careful of the consent, because we need to be very have the participants so that they know their rights at the beginning, so that we can involve and grow together as a good collaboration. Thank you.
Thank you. It was fantastic. Thank you for making this very important point. And this film took 7 years to make, because Agus' story is so interesting. It continues to evolve. So at some point we have to say, okay, let's just make this movie go out in the world. But also says about the importance of taking time before making available. This took a long time because we kept working on it. But also with our film, we've been finishing editing the first 2 years ago. More than 2 years ago. Then we took some time between filming, editing, releasing now is smaller setting like this, and then eventually go publicly. So the importance as well of having time before things become publicly accessible. And just mentioning also, Agus and I have written a paper about this experience as well. So you can also that is freely available. So you can also read that if you want to have an insight also from another perspective, using is a diary of his experience with the training and the mental health issues. Thank you so much, Agus. I'm sure you have questions to ask him, so we'll move on to him later on. And now, I have a question for Lilian. Can I, Lilian, go with you next?
Yes, please.
And I'm very curious, I want to know a lot about it. Unfortunately, we don't have enough time. But if you can tell us something about the experience of recording in the forest, and in particular, what did the experience of recording audios while witnessing the process of beekeeping bring to the research in comparison to other traditional research of, for example, formulated questions and our answers? So what is for you the difference in your experience?
First of all, I'd like to say this is different. I've done both the question and the answer kind of research, and then this using audio and document the how. For instance, when the elder is building the traditional hive, we were able to capture the Ogiek community. Their traditions are like their what do I say? Like the elders are the knowledge holders, and the young people do not know. So through this documentation, we are able to hold that information and be able to transfer. So it's hard to capture how to do something with question and answer. So this was a way of showing. So as much as I'm doing, I'm learning how to do it, and the young people are also learning. So it's much of a show that I tell. Remember, we are losing their traditions. So most of the capturing, the showing the young people, this is how it is done, rather than telling them, like documenting this tree. Remember, when you say this tree, it's disappearing. So if you show them, they'll be able to tell. Then I was able, through listening through the equipment, you're able to open your ears to the sounds of nature. So remember, I did some documenting in the forest, so you could hear the village waking up, the different sounds that were coming in. The cattle, the bells. When the cattle are sleeping, the sounds of their bells, they are few, and then when it's waking up, so there are a lot of bells. So that was one thing. And then the documenting using these creative means, it gives the participant and myself time to explore and give more information. So spontaneous songs. When somebody is sharing their experience, remember this is a community that has been displaced from their ancestral lands through eviction. So the emotions that when they remember, the nostalgia, you're able to tell it by seeing it. So not only me, but the people that are able to share this documentation with, they're able to see the pain this community has gone through. So we are being able to capture emotions through the tonal variations, the songs that they tell, they sing about where they used to live and now they cannot go. So those emotional variations, we are able to capture them and document them. I believe when we share, many people will be able to understand the pain they've gone through seeing and not just reading. It's giving it life for more than us. So I believe when we share, more people will be able to understand when we say evictions are they cause mental illness. You'll be able to see and understand what we've been talking about all along. That's all I can share at the moment. Thank you.
Thank you so much. Thank you, Lilian. Great. Now, Ben, I'm going to go to you. And I would like for you to reflect on the relationship of your production with the research. In particular, what would you say are the differing perspectives between field recordings and film when conducting research? What are in particular the strengths of this method?
Thank you. Yeah, I mean, that's an interesting question. I was thinking about this a lot actually, watching your incredibly powerful movie, which I really was very struck by. So thank you so much for making it and for letting me talk as part of reflections on it. I think there's some very obvious differences. One has pictures, one doesn't, obviously. But I think in the absence of a visual lead, you throw up, I think, a lot of space within which, as a creator, you can operate. And I think when we're making our podcasts, which I would of course encourage everybody to download and subscribe to, what we're thinking of them is as kind of continual sound pieces. So we're trying to capture, like Lilian said, and I think similarly perhaps to some of the landscape filming and the contextual filming in your film as well. We're trying to not just capture the story and the interview, but we're trying to capture the world within which it's taking place. Because I think on the one hand, we can say, oh, there's a man over there building a hive, but until you hear the tool hitting the wood and the grunt and the exhaustion, and you understand the work that's going into this cultural work, you're not really connecting to it truly. And I think film and purely audio experiences operate at very different levels. I think, there were some incredible moments in the film which I really appreciated, where, for example, I can't remember, they were in one of the big churches and they were talking and they were doing a group session, and you just cut to a shot of a foot with a chain on it. And I thought that was so powerful, and it didn't require words. And that is something you couldn't communicate through sound. You wouldn't be able to communicate that through sound. But I think simultaneously with sound, we can create other spaces. I think we can create a more kind of hypnotic.
Okay, we can read the stories.
Did you lose me? Sorry,
Yes,
I you guys in the space.
Yeah. Yes. Can you try to talk?
Yeah, sorry. Have you still got me?
Okay, you're back.
I'm back. Sorry. I think I was just going to say, one of the things about the podcast format in particular, or the audio format that we enjoy, is that listeners can experience it within their own context. So somebody can listen to it on a commute, or in a very quiet, private moment, or in a space where they'll be contextualizing it within an event like this, or just walking down the street. And I think you can therefore take these stories and experiences and let them, to a certain degree, enter your own life, and potentially create juxtapositions and greater or other reflections that you might not potentially have. I don't think either is superior. It's just audio just happens to be where we ply our trade.
Yeah.
But yeah.
Thank you. Wonderful. Very, very interesting points, actually. And now my last question I'm going to ask, and then it's up to you, all of you here and online. So get ready for your question or comment. But now I'm going to go to Lily and ask you, as the research fellow for this project and for the film we just watched, can you tell us more of the experience of conducting the research on site, and how you feel that the use of film might have helped to shape our investigation?
Yes, it's. I think some of my thoughts are similar to what Lilian shared and what Ben also just talked about. That it helps us to film.
We lost you. Okay. So
Hello, can you hear me?
We lost you. You said the film help us live alongside something, and then we lost you.
Okay, I was just saying that we can. It's very useful when we have film. Can you hear me though?
Yes.
Okay, when we have film, it's so useful to help us to sort of live alongside the participants. We can see so much clearer what they're doing and how they're doing it, and also in reflecting back after you go away from the field, you can go back and watch and get new learnings. I mean, each time I watch the film, the edited film, I remember different things, or I noticed different things, even though I was part of the research on the ground, So I think that has been such a big strength of using visual methods. A lot of what is talked about, the difficulties that the mental health workers go through, or people who attend these healing camps, some of the experiences that they have, it's something that is talked about, but seeing it is a different picture. At least for me, it was a bit different to see it, even though I had heard about what goes on in some of these communities. So I think that's the power that the film to the research, using these methods. Differently. And key learning that you can go back over and over and look at and relearn and assess or whatever. And it provides good grounds for dialogue with people. Academic writing is quite limiting in the audience that it will reach, but something like this is something that you can engage with at a lay speaking opportunity and things like that. So the reach is broader. Also, when there are people who can't read or write, when they can watch a film, the message gets across differently. So that has been very empowering to me in using film as a method.
Thank you so much, Lily. And now, to you in the audience here at home, my phone is back, and here, okay, yeah, yes.
So I was really struck by two things.
Just make sure people at home can hear what it is.
So I was just really struck by two things about this film, because on one hand you could see that it's giving an account of how mental health workers are engaging with traditional healers and religious faith healers, and how much that dialogue is contingent on a certain stance of humility and really ensuring that you find a sense of common purpose that facilitates that dialogue. And I was just wondering about the kind of other, outward-looking purpose of this film, this other ethical imperative of this film, potentially, where it's trying to challenge the kind of fairly reductive understanding of these modes of healing in the Ghanaian context, and how much, and I'm curious as to how much there's been buy-in amongst not just within Ghana, but also outside of Ghana, where there is a sense in which, pushing back against those narratives where it's really, really quite overly simplistic about what is actually occurring on the ground.
Maybe also if you can take it beginning too, and then maybe Lily can continue as well, so we can have both of you reflecting on this.
Yeah, thanks, Camelia. I think like Lily said, is every time I see the film, I see different layers, and obviously, we were there in the field, and we've, been doing research in this area for quite some time, and I think a lot of the, in the kind of models of collaboration, a lot of this complexity does get lost, and I think it tends to get reduced down in a way to the kind of medicine and prayer, funnily enough, although that's the common expression in Ghana as well, as if there's kind of some simple complementarity, whereas in truth, sometimes there is, there's a lot more conflict and kind of incommensurability between these different methods. And I think you could read the film as kind of a simple narrative of kind of collaboration, but actually when you watch it carefully, you can see that there are unresolved questions. And I remember when we were doing the editing of the film, and it was this incredibly painstaking process, which is the first time that I'd ever been involved, and it was kind of, all the kind of editing and line by line going through the meanings for the translations, etc. And I remember, I don't know if you remember, Lily, we had this discussion about whether we should, there was a point where one of the church pastors talks about the limitations of the medication, and the fact that we've seen that your medication doesn't cure, and so we add prayers, and then we add some herbal medicine so that we get a complete cure. And I think that disrupts the kind of simple, and so he's combining. We were talking about this in the break. He's combining a sort of neo-Pentecostal Christian framework with aspects of some of the indigenous religious practices in Ghana, and the plant-based medicines, which also have very powerful effects and are extremely popular for a range of conditions, and often very effective. So, there's a richness there that it's quite easy to erase, and I think, I've always I've always preferred to deal in the kind of grey areas and these messy aspects. I think that's what drew me to mental health in the first place, the kind of questions that are there, and that I think even after sort of centuries of exploration, we still haven't fully got to grips with. So, so Lily, I've gone on, but I wondered if there's anything else you'd like to say.
No, I agree with you, Ursula. Yes, and I think part of what also strikes me is that it's in a way also reflects some of the things that the mental health workers and in fact the healers have to grapple with. When we are thinking about building collaborations, what it means for each side of the health system. The ways in which the work that the healers do may be overly simplified, but then also the formal health system also does could be also looked at in a very simplistic way. And I think maybe that's part of the sort of tensions that we are starting to recognize that the film also highlights. The answer is not so smooth on either side, and I'm not sure, as Ursula said, we've raised a number of questions that haven't. But that's also the reality on the ground in trying to figure out how do we make sure that these collaborations are appropriate and how can we make sure that they're actually working and things like that. Those are questions that we're also grappling with in practice. So I just wanted to add that.
Thank you. And I mean, Ben, did you raise your hand? Does somebody want to say? Yeah. Go ahead.
Oh yeah, only if there's no one else in the space who has a question. But but I actually just had a question for yourself, Erminia, and also all of my fellow panelists, which was about any reflections you have with the concept, the presence of the camera lens within the spaces in which you've worked. Because I think one of the things that we found with field recording, for example, is that in some more sensitive contexts, such as working with Lilian in the communities she works within, or recently working with some Sami reindeer herders at their sort of annual cull, the camera is very intrusive and feels like almost like, you know, the risk of it feeling like a form of cultural colonialism when someone such as myself is holding it. And I think, you know, field recordings allow for us to coexist a lot more sometimes with the people we're working with, or for the people who are holding the microphones to coexist with the context that they're in. I just wondered if anybody had any reflections about the difficulties or any techniques or the ways in which you bring the camera and the lens into the spaces and the context in which you've been working.
Maybe I start as the person holding the camera, and then maybe Ursula or others, Anto and Agus and Lilian can comment on their perspective. So yeah, it is difficult, and also it depends also on the context. Obviously, in the more urban area compared to rural area, part of the world, or maybe people are more used to be constantly be filmed, and people actually might be not. So this is all very relative, but it is something else that is coming in the field. And obviously the presence is there. In terms of some way in my own work, that acknowledging that is still going to be there, the camera, what maybe sometimes facilitate in some ways is spending a long time. So in this project, we were filming for 2 months in Ghana and 2.5 months in Indonesia, and in the kind of usually the full day was dedicated to be in the field. And before starting filming in Ghana in particular, there was a lot of time spent in the community, not only for the consent, but in terms of the formality of a paperwork, but also for the kind of more rebuilding trust or restating the consent which was expressed before. So spending a lot of time, as much as possible time with the community. So the kind of more documentary style of going in the field, the filming and living, that obviously has a greater impact. Also equipment, like when I filmed the Breaking the Chains, Agus, if you remember, I had a big camera, and I was going with this big camera with, I'll do the sound as well. So normally I have these big headphones and the microphones on the camera, and I had a proper camera with tapes, which had even more of a presence in some way. So then I decided to start filming with the DSLR, and also not too big ones. And usually I have a lapel microphone. If you see in the movie, you will see sometimes we can see a cable of a lapel microphone, although I had a radio mic as well, because setting up the radio mic, I find that it takes so long, it is so intrusive, this package on you, and sometimes I go, you know what, I can film this without, I just do it as simple as possible, and not thinking about filming as a crew, because if I was there with 3-4 people, as it can be, like, then it's another dimension. So the researchers as well sometimes were holding mics when I needed somebody to take some ambient sound, because of people already in the field, but that to minimize the number of people involved, spending time, having simple equipment, and putting the relationship first before the best shot you can take. So sometimes, maybe as a filmmaker, we're going, okay, if I move here, it's going to be a better shot. If I come closer, whatever, it's going to be a better shot. But is that going to be even more an intrusion? So putting the relationship, the subject or the research, whatever we are researching first, and then the aesthetic is there, but it's definitely never the priority when I do my filming. That's from the filmmaking perspective. And then Ursula and Lily and the others, what is it? Let me pass my phone. She doesn't have my phone.
Lily, did you want to say?
Sorry, are you looking to me? I didn't hear that.
Yes,
Me.
we are staring
Okay.
at you, in fact.
Okay. Well, I think one of the things that, just to add to what Erminia had said, one of the things that I think was helpful in our case was because the filming was, the participants were, we worked with gatekeepers, and Ursula, as she mentioned, has done quite a bit of research in those communities. So she knew George and she knew Madame Regina. So, and they also then led us to the healers that they worked with. So there was already some sort of relationship existing over there. Although it wasn't quite the same with all of them. With Abu, we just met Abu and we managed to build rapport with him and follow them around. But I think that's time that we took to establish some kind of relationship helped to make it a bit less intrusive. Because they were familiar with Ursula and her work, and I also had some common grounds with George because I also work in mental health in Ghana. So those things helped to form that bond with us, and then it was easier to go around and watch them as they work. So I think that was quite helpful. Taking that time, sometimes it could be frustrating because we go back again and again to get permissions to work on ethics and so on. So it could be frustrating sometimes, but I think in the end it was useful, it was helpful because it was a bit more natural. Some people, of course, will put on a bit of a display. I think we did see some pastors who just put on a display for us when we were filming. But then we're also able to look at the everyday realities as well.
And I wonder, thank you, Lily, and I wonder, given Agus is here, and as you mentioned, he was a co-director in the film, but it was the main subject of that particular film project. So I wonder if you, Agus, maybe can talk about, when initially we met the first time through Skype, our relationship started, and then we met in person, and I was there with the big camera, and you were making decisions. And I remember at the time, you were very concerned about your neighbors being filmed, people knowing that in this house there was somebody, so people not be filming particular situation. We filmed only within your house. Then we went somewhere in a field, rice field, very far away and very windy, which then later editing we regretted the decision to somewhere where there was nobody. So if you can remember these decisions you made at that point in some sort, in terms of Ben's question, what was your thinking? What made you feel comfortable and uncomfortable when you were the person in front of the camera?
Yeah, because looking back when we are doing it, I haven't had the courage to share my story publicly in terms of my neighbors. But you know what? 2 months after we are shooting that first scenes, I was invited to the national TV talk show. So it was like the follow-up after I made the decision to share your film with you, with not involving any neighbors, because I was so concerned about, in a way I would like to preserve my relationship with my neighbors, because it's about my past is related to them with the stigmatization. But it was very different with this movie, because you are involving the community. We can see how people act differently when there's a camera around them. I think I captured this in this movie. But with my decision at that time, I just act just the way I am, because I didn't made it up any of it, and we are just doing it. And it was a consent. I was agree. Then through times, I think it stopped my, I'm doing. Oh, this is the advocacy. This is what I do. So I ready or not, I was taking the opportunity to share it in the national Indonesian audience because when I did the talk show, everyone knows. My neighbors finally acknowledged that I am a lived experience. I was experiencing stigmatization, and then it turns out grows, and through our relationship, it's not just about the researcher and the participants. It grow into much bigger than that. Then I also decided what should we do with the movie and what should we put in this the content, which part is. Yes, we had the same difficulties of cutting the scenes and with the sounds. I wish I had your team of sounds who's doing it now would be very different because but I'm lucky to be part of this. So it will be a journey. Perhaps we can do a future collaboration. Now I'm trying to. I finished my master's degree in health promotion and I become fully academician. I learn about research and everything. See what happens when you empower a person with lived experience, then it grows. We grew and we learned, and it opened many possibilities in the future of mental health advocacy. I think that's what I can comment on that.
Thank you so much.
Thank you.
And also to mention, I don't know if you spot his name on the credits, but Agus was also in the steering committee for this project, so for both Ghana and Indonesian film.
Yes.
And so it was nice to be able to have you sharing your experience and building on that as part of this other project. So thank you so much for keep sharing and keeping on your very good work. Okay, so here, who's next? People at home, don't be shy. It's much easier, you can just type it in and then Amy just send me a message with somebody in the audience, but then somebody from home.
Hello. Yeah, I was really interested in the fact that you wrote a research paper as well about it, and I just wondered why. That'd be just really interesting to hear a little bit about it.
Okay, thank you. So this project here, as Breaking the Chains, they are visual research project, and I'm in Middlesex University. I teach visual psychology, and I teach about using visual methods as a research method. So they are research projects where film is used as the way of doing the research. So all of our tapes, for example, for this film, the several hours of tape which were transcribed, and as Ursula was mentioning about to get the meanings, what people said, they were treated as research data because they were research data. And therefore then, in this case, Lily submitted a month and a half ago, a paper first authored by her, or Ursula, myself, and Kekle, which was our research, Roberta, our research assistant, also co-authors, which is a thematic analysis of what emerged from that project. Yeah. Before Breaking the Chains and the paper with Agus, I wrote a couple of pieces. One was an invited publication by Lancet Psychiatry to reflect about using ethnographic documentary as a research method for psychologists and visual anthropologists. So it was kind of bringing together these different approaches. And then Agus and I wrote a paper which was basically based on was kind of my academic kind of perspective on the issue, and Agus' diary and his elaboration about his own personal experience. So I guess what is a bit different from this way of doing filming is it is the research outcome. So what we got was fundings from the UKRI, because I mentioned Wellcome don't fund us, but who knows, maybe after today, next time we apply for fundings, Wellcome will go, now we wish to have our project with our Wellcome logo on it. So don't worry, we come back to you, Wellcome. But it was a research project funded by research funding. We went to consent form, into ethics committee, very lengthy ethics committee, one in UK, one in Ghana, one in Indonesia. Consent form, very long consent form, but they were research consent form. And this is the way that also my students, one of them is here, they are learning to do visual research. So from home, I know that now you all are writing a lot of messages here. I'm going to see now a lot of questions and comments coming from people who are on Zoom. Let me go with my finger and see. All right, that did not work. Persuasion. I'm usually quite persuasive, but did not work. All right. But we have people in the audience. Okay.
Hi, yeah, I just had a question about your processes for taking the research, for taking the films back to the communities that you have engaged in that process with, and if you could talk about that a little bit further.
So I'll talk about Indonesia later, maybe also with Agus this morning. There's some texting, like very early in the morning as usual. But I'll maybe because Ursula is gonna go to Ghana some point, not too far, and there was a screening in Ghana. So maybe Lily and Ursula can talk about what's happened in Nkabom in Ghana, and then I'll talk about Indonesia.
So we've already shown the film to some people in Ghana. So earlier in the year. No, last year. Yeah, we've done a few, like November last year, we showed the film in Tamale city in the north of Ghana, and also in Kintampo, which is a town near to where we did the filming, and George and some of the other people in the film came along. So that was really good, and we were able to show it to people who are training to be mental health workers, health managers, people with lived experience, some of the participants from my earlier research which was in Kintampo, so they came along. So that was really nice. We had a good audience. I think it was about 40 people or so in the College of Health and Wellbeing in Kintampo, where they train public health workers and mental health workers. So that was great. And then Lily and I were at a conference earlier in the year, and we showed the film again in Ghana, and we showed the film there. So we've had a few opportunities to show the film, but I'm very grateful to the University of Warwick gave me a bit more money. So Lily and I and a couple of our lived experience researchers that have been working with us on another project, we're going up to Nkranza, all being well, to show the film, hopefully to as many of the participants as want to come, which is something that's long overdue, and I'm really looking forward to them being able to come and see it and see what they think of it. So people from Techiman and Nkranza, and we'll take it back up to Tamale and have another showing in the capital, hopefully. So and we're planning to do some community conversations, we've called it, where we get people together to kind of think about what are the kind of lessons from the film and the way forward. So that'll be. So Lily's been busy following up all the bureaucracy to set that up so that we can organise that.
So we have plans of doing in both countries, do some kind of a community film screening before when we had the kind of the final cut to the film. But obviously because of COVID, and then we didn't get an extension. I don't see why we didn't get an extension. So we could not fly, and also people there could not really move much around. So Lily organized a small screening before there was a release of the film, in terms of the finalizing the rough cut. And in Indonesia we also had some kind of advisory group giving some kind of feedback before the finalization. So we did whatever we could with the circumstances, but in our project, research project, there was the component of us going back. So we were able to go once thanks to this other grant that Ursula was leading, which is, so just to mention, we also been working both for Together Mental Health and the COVID-19 project, producing participatory video, where we work to people with the experience of mental health issues and social inclusion, social justice issues, making films representing their experience, small group films. In Indonesia, we could only do online because we still could not travel there. And then in Ghana, in November, we were able to go there. So we kind of mix together and be able to make the most of these 2 weeks in Ghana, as always. And in Indonesia also we had a few screenings. Diana, who is not with us for this screening, you will meet her if you come back to watch Harmony. She's super active, so she's been showing around, using for students at UGM University. And Agus and I, this morning, I booked last night my flight for Indonesia, and I'm so happy to go back after 3 years. After filming, I wasn't able to go back, so this morning we were texting about organizing a screening of his film plus Harmony somewhere in Jakarta before Christmas. So we continue to do as much as so. Any opportunity to screen the film, so also here in UK, if you have contacts, it's important the film to get out. So we are very keen online or whatever. But from next year, after the films, now they're going to festivals. So we won a few prizes, and we is not as a team, we is everybody involved. There is obviously the many people who share the stories. people who contributed to advisory groups, steering committee, or any other help. So after we finish going to conferences and festivals, sometime next year we make the films available online for free. So anybody can hopefully make use as much as they can, because we need to learn, all of us. Also us watching them all the time.
I mean, we developed together, Lily and Diana and the team. We developed a screening guide. So if anybody here is involved in education, training health workers, etc., we have, because I think these issues, as Camille was saying, I mean, they're not just over there; they're here as well. Spirituality, mental health, people making use of different kinds of healing approaches. So we have, like questions for discussion, suggested topics, that people might, for different kind of audiences. So we're hoping, like in the next few months, to show in a couple of NHS trusts in London, to go and show to some of the mental health workers and perhaps service users and families, and maybe religious communities here in London as well. So that's the plan.
Okay, so we have both Lilian, Agus, and Ben who want to ask something or say something, but anybody in the audience here present who are urging to say something?
I had some comments to make when Ben asked a question on the equipment, especially using it in the rural areas. In the community that we work with, most of them have not seen these huge equipment. So when you bring them, you bring attention. So the challenge that I saw mostly when recording audio was when you need silence, you will not get it. You will have audience. There was a time a few children observed us recording, and they came in huge numbers. You cannot tell them not to come, and they'll come. So what we recorded were their feet running towards us. So we wanted silence. That was what we got. And it was so interesting because I think it was part of nature and what is happening with the landscape. Now, with the research on the effect of climate change on mental health, there's this issue of emotions. When elders are emotional, and perhaps there is somebody else, the wounded one, they are able to show these emotions to those who are around them. So that's something that we are, at least some will go silent on you for quite a while when you're recording, but at least after they are used to, at first, when you come with your equipment, they are anxious a bit. They're not used to these huge things on their faces and in their vicinity. So at first, it takes time for them to actually start looking at you instead of the camera or the sound equipment. So that's something interesting. But after you break the ice, they focus on you and it goes. So thank you for it.
Thank you for sharing, Lilian. And Agus, do you have something you wanted to say?
Yes, I think I want to small comment about the utilization of the movie. I think once, in 2021, I had the chance to share my story to the King's College students at Professor Hannah Kensler's class. So it's about introduction to global health. So it's really resources for students and academicians to learn using all of our this movie. And I had the chance to share it to every faculty or psychology that I asked to be a lecturer. So before the actual lecture happens, Diana or the lecturer always show the link and show this movie. So it will help us to deliver the material. Instead of talking about it over and over, you can just watch the movie and directly go to the discussion. So that's how effective of this method. And I think that. And thank you very much for being part of this. And we are looking forward to work with Ursula because we are now proposing another project with art and mental health. So hopefully.
inshallah. Okay, so anybody? Any comment, any reaction, any question?
Erminia, there's a question from Ben in the chat.
Which I think I got on my. I was going to go there. So yes, you want to say it, Ben? Or you want?
Yeah, well, it's a two-part question. It's one of those. One is just the behind-the-scenes one, which is what happens with the gun in the ritual with Nkabom, because you
I
showed
jumped
the gun,
every single
and
time.
we never saw what happened.
I didn't see what happened. No. What happened? Oh, because I was like, oh, wait, because it was so scary. You want to say what happened? Lily, tell us what happened with the gun.
I'm not sure whether I'm the best person. Maybe Ursula may understand it better, but they fire the gun at intervals when they're doing the rituals. And I don't know whether it is meant to wake up the god or... I honestly don't know what they do it for, but I've seen them do it from time to time as they are doing the drumming and the dance, and then at very unexpected moments, so then it always gives us a jolt. They fire those guns. I've seen it happen in more than one shrine, but to be very honest, I've never asked what it's for. Okay. So I don't know whether you have asked before.
Yeah, what they said to me is that the bullet travels, to find your enemies kind of magically, right?
Oh, I see.
Yeah. So you can go. Do you remember when we went to the shrine and they were queuing up with their petitions for the priest of the shrine? Yeah. And so he would say, this has happened to you because there's this witch in your family, and then they fire the gun, and then the bullet will go and kind of magically kill or destroy that evil. That's the understanding that I when I asked, that's what I was told. So yeah, but it's a really interesting historical, because obviously the guns came, with the slave trade, and these traces are everywhere.
A second part of the question was just, do the faith healers themselves then that you met, are they a sort of a discrete set of practices? Does every one of them have their own set of actions and practices and rituals, or is there a sense that within regions or whatever there are certain types of?
Should I take it or?
Go on.
I think there is some similarity. But then all of them also sort of develop their own unique method. I don't know whether it's even appropriate to say whether they develop it, because most of the time they say it is that's their calling, or that's the way they are. That's how all God uses them, because their methods are all based on divination, so they do what is revealed to them to do. So you may find a lot of similarity. There may be lots of prayers, there may be libations that need to be made, there may be fasting if it's like a Christian, even in the traditional, there may be the requirements to fast for a certain number of days, there's holy water and anointed oils. So there are those similarities you'll find across a lot of the different faiths. But then the ways in which they are prescribed will differ, not just from healer to healer, but even sometimes from patient to patient, because there's divination that is done, and it is revealed to them what the problem is and how the problem is meant to be fixed. So so somebody may have a requirement to fast for 3 days and drink only holy water, whereas somebody else, it may be 2 weeks or 40-day fast or something like that.
There's a lot of innovation, because it's like, in a way, you want to show what you've got that someone else hasn't got. So there's a lot of kind of cross-fertilization. It's a really interesting. There's been quite a lot of historical and anthropological research around kind of these healing traditions, and how, what's interesting in this part of Ghana where we did the filming is that, they've kind of cross-fertilized with traditions in the north. So a lot of the dress that they wear is actually traditionally northern associated with people in the north of Ghana, and then they kind of bring that down and kind of adopt some of those traditions, whereas this kind of grass skirt is like something that you'd associate with this part of Ghana. So it's all really, really fascinating, and they will travel to bring gods from the north because they're considered to be powerful. So the ritual landscape is incredibly rich. So it kind of relates to what the question that was asked earlier, really, that sometimes, you know, it can be simplified down, but actually there's a huge variety. So when people move around, you know, I mean, you heard Malik's father talking about, you know, the pastor taught him to get a pig. But he also demonstrated, you know, skepticism about that, because he saw that, you know, he paid this money to get the pig, and then he went back to the pastor, and the pastor said the pig had escaped. So, you know, he kind of wasted his money. So there's also then it's really incredibly difficult for families, because they have to kind of make some judgments about how authentic this healer is, and whether their methods are really genuine, or whether they're just, you know, charlatans, as people will say. So it's an incredibly rich and fascinating healing landscape, you could say, yeah.
When you watch Harmony, you will also see that, interesting, there are some similarities, not only within the different healers in Harmony, although in the Indonesian film we followed three areas in Indonesia with the three predominant religions. So Islam in Java, in two parts of Java, and Balinese Hinduism in Bali, and Christianity in Flores. So we see similarities within that, although, as you were saying, also their own then differences. But also with the Ghana, some of the rituals, there are some elements of it. Not only what was used, for example, the water, but some elements that you actually see, you know, that they kind of seem to be repeating in some form, although they are different, but the substance seems to be similar. So again, an invitation to also watch Harmony when we'll be screening it. Let me check my phone to see if there is any other question from from people at home. No, and from the floor.
Actually, I want to ask something.
Yes, go.
First, yes, what happened with the people at the end of the movie? It shows that they passed away because of what? And a bit of reflection on this movie, because I see a lot of my story, which is people with the chain walking around with you know, some chains still attached to the feet. So it's really shocked me that is still happening. You know, the chaining cases is still happening everywhere in low-middle income countries, especially at how the mental health worker works, because they work with very limited resources, as what we are doing in our NGO, and we are doing it to support people with mental health condition and their family without any support from the government. So I feel a lot of similarities of situations. So yeah, so I think it shows that some of the same problems that we are still facing. Thank you.
Yeah, thanks, Agus, because I mean, that's why Erminia and I felt these two countries, Indonesia and Ghana, although in many ways very different, but these shared issues, as you said, around the use of restraints, but just to say that, you know, of course, these issues around restraint, I mean, as we speak here in London, you know, there are people who are in hospital against their will, who have been restrained and injected, you know, without their consent. So these big ethical issues are everywhere, not just in low-income countries. So, but to your question about the people who passed away, it's very sad actually, and it's a reflection in a way of the, you know, inequalities in terms of life expectancy. You know, it's a lot lower in Ghana than in other countries, and many people I know in Ghana die, and sometimes you don't even know what they died from, because there aren't the tests there available, and they're very expensive to find out why. But Sister Regina, the nurse, she's someone that I met in 2016, a really amazing nurse who was a mentor to these young nurses. Very sadly, she had cancer, and so she died because of that. Prophet Elijah, I think he was an old man, as you saw him, so he died yeah, I'm not sure exactly what, but he passed away. And Malik, sadly, we don't know why Malik died or what happened. His father moved away from the village, and Lily and the nurses have been trying to find out, but to date, we don't know. But what we do know, like statistically, is that people with severe mental illness can die much younger than they should if they don't have proper care, and there may be comorbid physical conditions that weren't detected. We just don't know, and it's very sadly some people do also die. I know one of the participants from my PhD research died because of something that happened in a prayer camp, possibly fasting. So sometimes you just don't know, and it's, again, as you mentioned, it's kind of a big concern in terms of the treatment of people with severe mental illness, and making sure that they're protected and they get the care that they need. It's still really important. So thanks for that question.
Thank you. And I have an online question alert. Okay, so thank you, whoever the person from whom was written these questions. There are two, and perhaps Lily, you can tell us, but also you, Ursula. My question is about the funding of mental health treatment by the authorities in Ghana. I've heard that only a small percentage of the amount that is made for mental health is used for this purpose at all. Is the film also used to bring about a change in the policies of the authority? And are praise camps partially funded by the government, or mainly psychiatric clinics only funded? Lily, can you tell us something?
Okay. With respect to the funding for mental health treatment, I think George mentioned it, that there isn't a lot of funding made available in the budget for mental health work. It makes up a very tiny amount of the health budget every year. And the point that George was making was that even what is made available tends to be focused in the psychiatric hospitals. And so very little of it, if any at all, goes to the community mental health centers or the community mental health units across the country. So there's not a lot of funding for the work that they do in the communities. Sometimes they have to, with respect to transport, for instance, I think we heard Sister Regina talking about how they had to pay for their own fuel to be able to go on their home visits or to do the community engagement activities, but then they pay out of pocket to go. Sometimes they will have to join other health programs, when there are public health programs on reproductive health or other kinds of public health projects, they would maybe hitch a ride, as Sister Regina said, and go along with those people so that they can do some of the engagement. So there isn't a lot of institutional support for better health, especially in the communities. But as I always say, that things are changing. With the new mental health law that we had, there are requirements for things to change a bit more. We haven't gotten very far with bringing about those changes. But community mental health care didn't even used to exist in a lot of places around the country. And in the last few years, we have seen units being opened up everywhere. So gradually things are changing. We would like to see better things happening or more change, but we're starting small and crawling along. With respect to the prayer camps, those facilities are all private. The prayer camps are mostly run by churches. These neo-Pentecostal or charismatic churches run these prayer camps. So it is not funded by the government or the mental health authority at all. However, one of the things that the community mental health workers are required to do is to build these kinds of partnerships with people who run these prayer camps so that they can go and monitor what kind of care is being given. They can sometimes begin treatment in these places and so on. So the funding is not from the government, it's from the churches. They're done privately. Some some of the places participants or patients are required to make payments for treatment. So it's all very privately done, not through the authorities. I hope that answers.
Thank you, and I'm aware we are kind of finishing the time, and Nikki is coming closer and closer to me, which I think it means okay, you need to tell now that Nikki is coming back in the scene. But before we close, if you can here just leave Lily, if you can close with you having last final 1 minute, 1 minute thought about giving your involvement and having witnessed in terms of be part of a project which has involved the collaboration between researchers, filmmakers from the global north and the team in Ghana. What do you think are the lessons for future research, particularly in regard to using visual methods for mental health and human rights research?
Okay. I think that this film has been very useful for me as a researcher and as a mental health professional to look at the possibilities, right? To see what could be done when we think about collaboration, what is actually happening, how we could think about collaboration differently from the way it's traditionally been thought of, or the way in which it has been approached. This is more, it opened up the door for me to see what it could look like, how it was working in other spaces. And I think that's a useful thing to think about when we're doing research on mental health and thinking more about improving access to care and so on. So research using visual methods is to me a very powerful tool to be able to show those possibilities, to show what can be done. And it also helps to foreground some of the actors on the ground, you know. It's not just about the researcher anymore, it's about the people. We can see their story. We didn't feature in it, at least not very much, although we sort of determined how we edited the film, but we, as much as possible, tried to make sure that the story was about the people. And that's something that I think is very useful, so that it's not just our voices in the mix, it's about what's happening on the ground and how those things can inform how we think about things like collaboration. So yeah, film is absolutely a very powerful medium that I personally have fallen in love with, and I think I'll be looking forward to doing more visual things in the future.
Welcome. Let's take note of that. Thank you. So Nikki, if you can come here and close the event. Thank you for having us.
All right. Thank you very much, everyone in person, and to everyone joining online. And to all the speakers, I know it's quite late where many of you are, so thank you very much for this discussion. It feels really important, and especially hearing you noting about the kind of community conversations, and Agus, you were saying the like national TV, kind of having these different platforms feel so important for the kind of discussion. And I just kind of one very quick reflection, hearing the story of like taking the camera and recording in the rice fields, and it was making me think of Lilian when we were recording the podcast. And the one night, Lilian, you said you had to stay overnight to listen to the hierarchies to get the recordings right, and it's just kind of these like stories that you don't always hear when you see the film, and it's just also so interesting and rich to hear it. So thank you very much. And so just in closing, in a moment there will be some tags of the Together for Mental Health, and it's not on the screen, but you can follow at Movie Mint, and there will be more information about upcoming film screenings there, like Harmony, as Erminia was speaking about. We also, Invisible Flak has some forms as part of our Arts Council funding England, so on your way out, if you have a moment to take and fill in a bit of a survey, that would be really helpful to us. Other than that, I just want to say a really, really big thank you to all the speakers. It was such a pleasure to work with you, and I think it just ties in so well when we think about creative methodologies and visual methodologies, and thinking about the work of the Body Ecologies Research Project, and yeah, just the importance of that. So thank you very much. Thanks for coming. Thanks for having me.